Okay, everyone, in this particular section for the home health aide, home caregiver, or homemaker training, we are going to be talking about the rehab and therapy portion of this program. As a home health aide, we should be aware that we have clients that are going to be at home that's going to be receiving therapy and rehab, as well as being a caregiver or a non medical private duty homemaker. We have to be familiar of what possibly will be faced with the client, especially when we start talking to some of their medical teams and the guidelines that they're going to be giving to us while we are taking care of the client at the comfort of their home. So let's go ahead and get started by defining rehabilitation. Rehabilitation is the care that is given by specialists to help restore or improve the functions after a particular illness or injury. Sometimes they get rehabilitation at a nursing home after they've been admitted at a hospital. But at the same time as rehab continues on from discharge from the nursing home to the home. So we need to understand that rehabilitation in terms of moving the client from and regards to illness to health. If they were sick at the hospital, they go home, they're going to need rehab so that we can actually get them back to at least a better healthy situation than they were when they were in the hospital. From disability to ability, from dependence, where they're depending on the total care of everyone, to being able to be independent themselves, or be independent but maybe still have some assistance from you or from someone who's working with them at their home. We need to be able to help that client, that patient, regain a function or recover from any illness. We need to be able to help and develop and promote the client's independence. And at the same time as during the care that we're giving to them, we need to be able to give them the feeling of control. Give them the feeling of independence, helping the client or the patient accept at the same time or adapt to limitations of the disabilities. Sometimes if a person has a recent stroke, we will probably have to be there for them for a long period of time. And they're going to be able to maybe regain some part of, being able to be independent, but there'll be more likely something where they're still going to need assistance from a person like a home health aide, like a caregiver or a homemaker. We need you to remember that when you work with your clients, when you work with your patients who need restorative care, you will be working as part of a team. It's not just you as a home health aide that's going to be doing ADLs, such as activities of daily living, or doing basic home care, or being a caregiver, or just being a homemaker. It's not just you, okay? For them to be able to get the full restorative care that they need, there's going to be additional people, doctors, other physicians, specialists, nurses, therapists, such as physical therapists or occupational therapists, or even speech therapy as well. So we need to look at the whole home care rehab model. It starts off with the physicians who establishes the goals, the nurses that promotes independence and restore health, the therapist, which the physical or the occupational will work with the patient or the client and help try to restore their abilities. There may be counselors, like a social worker that may be involved in things. There's a home health aide, which assists with the goals, observe progress, as well as report to the nurses. But in addition to home health aides, if you're a caregiver or you're a homemaker, you may be assistants as well. Because if you are a homemaker or caregiver, you're going to be there fully and be more active with that client or that patient compared to the physicians, the nurses, or the therapists. So let's go ahead and think about this one quick question. How does the role of each member of the care team contribute to the overall goal of the restorative care? Well, they all have a part in it. Okay? They all have a part in the whole goal of the care of that person. Each person is important to be able to create that wholeness for that client. We need to understand that home health aides or home caregivers, we need to understand that your attitudes and behaviors will assist the client with their restorative care. So you need to be patient. You need to be positive and supportive. Try to be able to focus on small tasks and small accomplishments, okay? You cannot just expect them to be able to be bedridden and all of a sudden running. So we need to understand that we need to recognize that there are setbacks that can occur, that they cannot do things fully, completely all the time. Other things is we need to be sensitive to the client's needs. We need to definitely be able to show encouragement to them, be able to give them the ability to have independence back, to be able to reclaim that independence, to be able to make sure that we are involved in their care, encourage the fact that they can be independent, that it is a possibility that if they work hard, if they actually take time, concentrate, and follow the therapy, that there is a potential way that they can improve themselves from where they are currently. So, how can you adapt your motivational styles to fit the different and unique personalities of your clients? Well, you need to have that can do attitude. You need to be that cheerleader behind that person. You need to be making sure that you encourage them, that you tell them that they can do such a thing, that they shouldn't settle for less. All right, so moving on, let's go ahead and talk a few more different terms we should know. Contracture, which is a permanent and often a painful shortening of a muscle, and that normally happens due to lack of activity. Atrophy, on the other hand, is the wasting away, the decreasing in size and weakening of muscles from lack of use, right? And then the range of motion, or ROM, is the exercises that we have to do with our clients, that is assigned to the clients to do. And these are exercises that put a particular joint through its full arc of motion, the full range of motion, as they may say. Active range of motion, on the other hand, is exercises that put a joint through its full arc of motion that are performed by a person alone without help, that they actively can do it by themselves, okay? Which is different from passive range of motion. So active assisted range of motion are exercises to put a joint through its full arc of motion, which is the range of motion, that are performed by a person with some assistance from another person, either a therapist or even you as a home health aide or a caregiver or the nurse. The passive range of motion is exercises to put a joint through its full arc of motion that are performed by a caregiver without the client's help. Okay, so this is also important if a person is bedridden or if they had a recent stroke or they're in a coma. We still need to make sure that we're allowing that person to have a range of motion exercises, whether we have to do it for them or they can assist a little bit with us. So these are different types of body movements that you should know. So from abduction to adduction. So abduction, if you look at that first one, that means from a regular standing where your feet are squared apart, with your shoulders, that you're going to move from center to the outside. That's abduction, okay? The second one is adduction. So if you look at the first three letters, add. So what you're trying to do is your foot is away and you're trying to add it to your body by bringing it towards the center part of your body. Extension is extending your arms out. Flexion, just think about when you're flexing your muscles, okay? Now you're looking at on the bottom row, you have dorsiflexion, okay? If you ever tried that where you're actually going to try to have your toes reach northern towards your head, towards your skull, okay? That's how you're going to do that, okay? So you're going to feel that that tightening of your muscles right on the top of your foot. Then that's dorsiflexion, and then plantar flexion is when you're going to try to plant your foot and push your foot forward. Rotation, as you guys see next, and then pronation and supination. Pronation means your palms down. Supine is your palms up, okay? So let's talk about that. Abduction, moving a body part away from the midline of the body, okay? Adduction, moving it towards the midline of the body. Extension, strengthening the body part, okay? Flexion, you're bending a body part. You're flexing your muscles. Your dorsiflexion, okay? Bending backwards. Rotation, turning a joint. Pronation, turning downward. Supination is turning upward, and opposition is touching the thumb to any other finger, okay? So looking at these guidelines for proper alignment, because it's important for us to have proper alignment and to be able to encourage our patients to have that, we want to be able to observe the principles of alignment. We want to be able to make sure we keep body parts in its natural positions. You want to try to prevent external rotation of the hips, and also you want to promote them to be able to changing positions frequently. So why is prevention of pressure ulcers a very important part of the skin? We've discussed this in the past where, pressure ulcers occur when we are actually having a lot of pressure towards bony prominences in our body. And so what ends up happening is if we allow a person to actually lay down on their back for a long period of time, if you've ever done it where you put pressure on your fingernails, you'll see how the fingernail beds will turn white. Of course, this is if you don't have any nail polish, okay? You'll see it turn white. So the reason why it's turning white is because you're pushing the blood away from that area. And so when you do that to bony prominences or anywhere, what happens is there's no oxygenation in that area. And so if there's no oxygen that is feeding those capillaries, those areas in your skin, then eventually, without oxygen, the cells will die. So it's very important that we turn the person continuously, because if your skin dies, then it'll break down. And also, we need to prevent that. So we need to really prevent the possibility of any pressure ulcers. Henceforth, we need to reposition a person if they can't do it themselves, at least a minimum of every 2 hours. So if we can prevent problems from occurring, because we have to understand, we are unfortunately in a time of medicine where it is more about solving the problem that's at hand, whether other than trying to prevent it. So instead of being proactive, we're reactive. We wait till there's a symptom or a diagnosis where we should try to promote health instead. So here are some guidelines to be able to prevent pressure ulcers. You want to be able to make sure you report changes in the client's skin. You want to be able to make sure you provide regular skin care. Repositioning is very important on the client. You want to be able to change the clothing and linen often. And the reason for that is if it's soiled, if it's sweaty, or the person accidentally urinated on it because they were incontinent, those acidity can actually prevent or can start actually breakdown of the skin. So you want to be able to change the clothing and the linen often. And then when you're changing the linen, whether the person is in the bed or not, what happens is if they're in the bed, that means you're still moving them. So there is some movement with the patient or the client that's going on. You want to try to avoid scratching or irritating the skin, and especially reporting blisters or sores on the feet. Because typically, especially for diabetic patients, this is a problem when they have blisters and then they have, small scratches in the skin. It can cause problems. It can start, either a pressure ulcer, but if it's a scratch, normally what's going to happen is they may have just an infection in that skin easily, because if you remember, diabetics can get infections a lot faster. And also, to avoid any skin irritation is to avoid any of those harsh soaps and detergents. And those are some good ideas to be able to help prevent pressure ulcers. Additional stuff is, massage skin frequently, but at the same time as you don't want to be massaging a skin that's bruised or appeared bruised in the area, because you might damage it even further. But just having a nice soft massage will increase the blood flow to that particular area or to the body. You want to make sure that you're gentle with transfers. A lot of seniors, as they get older, their skin gets pretty brittle really fast, and we want to prevent any skin tears. You want to keep the skin folds clean and dry, and what happens is those skin folds, if somebody is overweight, can get moisture, and moisture will assist with breakdown of the skin. So we want to try to keep the person clean and also dry. Having a well-balanced meal, especially protein, it's very important for the healing of the skin. Okay, we want to be able to have that nice, well-balanced meal for any client. If they need to be able to speak to a nutritionist, that's also important as well. You also want to try to be able to make sure you follow the care plan of the clients. Okay, you want to follow the care plan that's given of the client. Now, let's talk about bed-bound clients. That means these are clients that are unfortunately have or does not get out of bed too much, whether it's a disability or it's a particular diagnosis that they have. So if somebody is bed-bound, we have to make sure that since they're laying in the bed all the time, we're turning them in a good schedule. And at the same time, is you want to avoid wrinkles in the linens, because those wrinkles can cause pressure areas and can cause breakdowns. You want to avoid shearing, so we want to be able to make sure that when we're transferring the patient or we're moving them up in the bed, that we avoid friction from happening. There's a lot of protective aids that we can start using, like sheepskin, or a chamois under back, and for the back and the buttocks or in the wheelchairs. It's that soft cloth kind of. You typically see chamois in like regards to cloths being used to like wax your car. There's a lot of sheepskin that we can put, or some specialized foam mattresses for especially the bony prominence areas. Um, they have what they call flotation pads or egg crates on the either the bed, the chair, and the wheelchair. They have what they call a Rojo mattress, which is a brand name item that kind of has a air cushion between the person's body and if they're laying in the bed or they're in a wheelchair. So these are ideas that you can have. And once again, if the patient is in a wheelchair or in a bed or whatever they're sitting up, we always want to reposition them. So this is if a client is in bed all the time, if you guys see here, this is a heel protector. We put these in the clients to be able to prevent sores. One thing that you see here, for example, is it pretty much protects the heel and also protects their ankle area as well. So here's additional two more terms we should know. Fracture is those broken bones. Osteoporosis, especially for a lot of senior citizens that are female, can get this. It's that disease that causes the bones to become porous and brittle, causing them to break easily. So a lot of people, a lot of senior females, especially senior ladies, what ends up happening is they have a lot of complications in relation to the osteoporosis, because this is when they have a fall and they can break a hip or break a leg really fast. It just makes the bones really brittle. So if somebody does have a break and they actually have a new cast that's placed in there, or even an older cast that's been there for maybe a couple weeks, we want to be able to know how to provide good care for them. Never ever cover until dry. Do not place on a hard surface. You want to be able to make sure you elevate the extremity in the cast, okay? You want to be able to observe for swelling, skin discoloration, tightness, sores, hot or cold skin, pain, burning, numbness, or tingling, drainage, bleeding, or odor. You want to be able to monitor this, and the reason why is these all can show that there is possible infection, especially if it gets to the part where there's an odor that you're smelling from it. You want to avoid if somebody says they're itchy, because remember, you have a cast on your skin, so moisture kind of dries up a little bit in the skin area, so it can get itchy for a client. So if somebody says, hey, can you pass me over one of those wired hangers, I want to scratch something, avoid that. Do not let them do that. And the reason for that is if they scratch something and it's an open area, it can cause a sore in there, and we don't want any infection happening. The tightness of the feeling, you don't want to avoid compartment syndrome. The last thing you want is that, things swell up in there and then things get so tight that they lose circulations. So we want to be able to make sure that anybody with a cast, whether it's new or within the week or within the day or even within the past month, we want to be able to monitor these things and make sure that they are not being affected by any side effects. Additional things that we can do is you want to be able to maybe keep the cast dry. So every time that you're going to take a bath, you want to be able to put a plastic sheet over it so that they don't get water in it and it doesn't get wet. Remember, once again, do not insert anything into the cast. You need to be able to help them as needed. If you need to elevate things, elevate it as well. So we talked about earlier about osteoporosis, and a lot of senior ladies, unfortunately, will get a lot of complications, especially broken bones because of falls. And then having the osteoporosis does not even help anymore. So we want to be able to make sure that if somebody has a fractured hip, okay, we want to be able to understand that if they're older, the chances of things healing takes a little bit longer, if they were young. So we need to also understand that other than the broken hip, we need to look at secondary illnesses and infections. Does the bed rest for the client all of a sudden start something where they get pneumonia, or do they get any infection? So we need to be able to make sure that any seniors, especially with hip fractures, that we need to be able to monitor it. And we need to understand that hip fractures is a serious condition because it makes a person immobile all of a sudden. There's a lot of things that can actually occur because of them having a hip fracture. There's a lot of secondary things that can happen to them. So if somebody has a hip fracture and we need to start providing them care, you may hear a lot of the people in the medical team talk about partial weight bearing, non-weight bearing, or full weight bearing. Partial weight bearing is a doctor's order stating that a person is able to support some body weight on one or both legs. The non-weight bearing is a doctor stating that a person is unable to touch the floor or support any body weight on one or both legs. Full weight bearing is a doctor's order stating that a person has the ability to support the full body weight on both legs. So if somebody has a hip surgery, we want to be able to make sure that we, dress the affected side first. Okay, we want to be able to keep a lot of the items that they use nearby so that they're not trying to reach forward or trying to overextend themselves and accidentally have a fall. You don't want to rush the client. Remember, they just had a hip replacement surgery, so don't be rushing people. Give them some time to be able to adjust. You want them to be able to conserve energy. And also, just for any care, we always want to follow the care plan when we're giving care. Never perform range of motion exercises on the operative side. Okay, you don't do anything unless there's a doctor's order and you've been instructed on it. The legs never ever can be crossed. The hip can be bent more than 90 degrees, but you cannot cross the legs because that may make the hip pop out. Okay. Always want to make sure there's a pillow between the thighs when you're transferring from bed. That pretty much what it does is it kind of stabilizes the legs so that it doesn't cross or just overextend. Okay, so for chair or toilet transfers, always use a stronger leg that needs to stand up first. Then always keep that operative leg straight forward. Okay, so you always want to use the good leg to stand up and to help with the pivot and the transfer. So here are some of the signs and symptoms that we as caregivers, as homemakers, as nurses needs to observe and of course report. If we see anything on the sites, it's from redness, drainage, bleeding, and warmth on those incision areas, that might be a showing that there's an infection. If there's an increased pain in there, if there's that numbness and tingling that's being felt, are there any abnormal vital signs that we're monitoring when we're taking the vital signs, if we're required to take vital signs? If there's any inability of the client to use equipments properly and safely. So we need to do some patient education as nurses and as caregivers, therapists, home health aides, homemakers. We need to kind of do some basic assistance for the client as well. We want to keep them healthy at home because that remains and that allows us to have and keep our jobs. Okay, if there's a problem with appetite, remember they need the good nutrition to be able to heal right away. And so if they don't have a good appetite, we need to find out what's going on. Is there anything secondary, tertiary from that? We want to be able to make sure that we provide them the therapy so that we can show and help the client increase their strength and also improve their ability to start walking again. Okay, so let's talk about adaptive products that can help clients, especially if they have a stroke or they have had problems. So we have a couple items here in the photos that can kind of help them, with things. Like, for example, you see the gentleman by the chair, and he has one of those hooks that can help put his pants on, right? Because he cannot overextend his hip. He cannot overcomplicate things. And let's say, for example, the middle photo, you have a strap that will help a person hold on to their spoon. And those are very good things to be able to have. On the last photo, using pillows to be able to make sure you elevate the body. That's always good as well. So we also need to understand that there's things that happens where people will have incontinence. And what that means is that they have problems where they actually have accidents, whether they unfortunately either has a full-on, drip in regards to urinating on themselves or just a little small accidents, as they may say. So an incontinent is being unable to control the muscles of the bladder or the bowel. Okay, so let's look at the different things that goes on when a person is incontinent. So most of the time is a result for circulatory or nervous system diseases or even injuries. People that are paralyzed, right? They are not able to control their muscles, so that's why they have also problems when it comes to incontinence in urine as well as bowels. And of course, at the same time, is if somebody has diarrhea, if somebody has a stomach infection or whatever that they have, the diarrhea, sometimes they cannot control it and can cause problems as well. So we always want to be able to make sure we reassure and offer understanding that no, it's okay, it happens, and that's what we're here for, to care for you. Please don't feel bad that this is happening to you. To be able to kind of decrease the chances of incontinence, start offering to toilet them a little bit more frequently. Our job as nurses, as caregivers, and homemakers is to keep the client clean and dry. And at the same time, is provide good skin care, perineal care. That's natural. We need that. You want to be able to make sure, if need be, using draw sheets, okay? And at the same time, is make sure we change disposable briefs immediately when they are wet or soiled. We should never ever let a person lay in their own urine or feces once we know it's there. And we should try to prevent that. That is our job in the healthcare field, is to make sure that we care for our clients. Now, always remember, do not refer, okay, to incontinence pads or briefs as diapers. All right? We're never going to say, I need to change your diaper. Because what are diapers for? They're for babies, not for adults, okay? So elderly people are not children. Remember that. And such references are demeaning to adults if we all of a sudden bring them right back down and try to compare them to a child or an infant. And we shouldn't do that. So let me ask that. How would you feel if you were incontinent and then had to rely with others to be able to help you use the toilet? How would that make you feel? Could you let someone else change your underwear? If you're 20, 30, 40, 50 years old, whatever you are, if you're already of sound in mind, you already graduated from diapers a long time ago, how would you feel if you were actually going to need an assistance from somebody to help change you? It's not a good feeling. So let's talk about several of the types of bowel training items commonly ordered by physicians. Okay, and when we talk about bowel training, we're not talking about training yourself, to potty training or any of that things. It's pretty much anything that we can order for you that provides assistance for the client, from suppositories to laxatives to stool softeners all the way to enemas. Suppositories, those are, medication that gets inserted to a person's body via rectally. And so what that does is, these are different things that we actually give, whether if the person's is the person constipated or having problems moving their bowels, we may do this. They may get laxatives. The laxatives are medication that helps you poop or pretty much defecate. Stool softeners softens your stool. Okay, it doesn't help you move. It actually just softens the stool. Enemas, on the other hand, are, what they do is they will actually give you an enema and also gets inserted rectally, and this pretty much will clean you out and assist you to defecate or just clean you out. Or if there's such a really, really bad stuffiness where things are just hard, this is going to be able to help clear things out. We need to understand how you as a healthcare person may assist in bowel and bladder retraining. And so we want you to be able to follow the following things. Follow your standards of precautions. Always wear gloves. Remember, when you're touching somebody and you're going to be exposed to a potential, body or bodily fluids or blood, you always want to make sure, okay, that you actually keep yourself protected. But of course, before you put your gloves on, always make sure you wash your hands. After you take off the gloves, always wash your hands as well. You always want to be able to explain to the client what the steps you're going to be doing for them. And also, typically, depending on your facility, keeping a record of their bowel and bladder habits. If need be, offer them a bedpan or a trip to the bathroom before any procedures. Always encourage fluids, because remember, if a person is dehydrated, it increases the chance of them being constipated as well. It also goes by with a lot of clients that are taking a lot of narcotic medications. A lot of narcotic medications actually causes constipation as well. Always understand we need to encourage fluids, encourage a high fiber diet to clients. We want to be able to give the clients the ability to actually use the bathroom by themselves independently. You want to be able to not rush the client or never make the client feel bad that he has to do something and we're there watching or listening or waiting. Also, if there's any soiled linen or anything, we need to make sure that we get rid of that and dispose of them correctly. You want to be able to wash items separately from the others. Always bring out a positive reinformation. Good job. I'm glad we were able to do that early. I'm glad that, you were able to, urinating yourself by accident, we're here for you. You never want to show them frustration or anger. You want to be patient with the clients. These are all very important things, especially when we're actually working with clients and trying to either get them into a schedule or helping them retrain themselves for both bladder and bowel as well. So, what suggestions or tips can you think of to keep a positive attitude when you're assisting clients who are incontinent and have accidents? What suggestions do you have? We shared a lot of them with you, right? You always want to make sure you explain things to them so that they can actually feel that they're involved with their care. To be able to talk to them, encourage them is very important. So, what else do you have any ideas of? Go back in a couple of the slides and just take a look at that and then come back forward. All right. So other things that we have to do is a person is respiratory problems or just came back from the hospital or the nursing home with respiratory problems. You probably see them with something like this. It's called an incentive spirometer. This pretty much measures the volume on how their lung volume and lung capacity. So we want to be able to make sure that we actually help them with these exercises. Pretty much you're just gonna have to blow into that tube and see how high it's able to raise up and to be able to see what is your lung volume. And what that does is to be able to help the clients, especially with to avoid any pulmonary embolism or pneumonia. Deep breathing exercises is very important for clients. It helps expand the lungs, clearing them of the mucus and preventing any infections. Okay, some clients who are paralyzed or who have had abdominal surgery are often encouraged to do deep breathing exercises regularly to expand the lungs. We want to be able to expand the lungs. It's very important that we actually exercise that as well. So, we've gone through a few ideas and a few items that you should actually learn. I'm glad that we're able to share that with you.